These patients would need antifungal therapy as typical for invasive fungus. Ideally, this would be culture-directed, and so it's important to obtain cultures of the tissue itself at the time of surgery. Antifungals without debridement and cessation of the drug use to stop the problem are going to be ineffective. Some of the proposed mechanisms of this process include vasoconstriction, which would be similar to the mechanism of intranasal cocaine tissue deterioration, autoimmune vasculitis, hyperosmotic tissue injury, similar to pill-induced esophagitis, and talcosis, similar to pulmonary processes. I hope that I have demonstrated the importance of recognizing opioid acetaminophen nasal necrosis. Recognition of this entity and employment of appropriate treatment paradigms is necessary for the recovery of these patients. Thank you so much.
Let me ask the technicians, do we have the opportunity to talk? No? Okay. What I mean is, do you have any questions or any ideas about this specific topic? But I think it's specific to the United States. I've never seen it before.
In Ukraine,
you see that. My question to the audience is, how many pills do you need to take every day to result in this, to end up with this massive necrosis? I mean, it should be tens of pills. Okay, that's because it's a very low dose. Acetaminophen.
Maybe it's not the drug itself. Maybe it's not the drug itself, nor the dose. It's the stuff they wrap it around with.
Yes, just for our colleagues in the States to be part of it. The question again is, how many pills? Okay, it could be, I agree, could be the reaction to talc, correct. But we would like to have their input. The other thing we should note is that in certain countries like India or Asia, we have a high prevalence of rhinoscleroma or atrophic rhinitis, which could also present with this picture. So we have to keep that in mind, because populations now migrate a lot. Μπορούν να μας απαντήσουν από την Αμερική?
Όχι, δεν έχει, είναι στο Zoom.
Okay.
Right, that's all I have to say.
Does anyone have to make any other comment? Just to make it interesting? Another question for the audience is, did these patients with invasive fungal infection, 20% had invasive fungal infection, could that be the inciting event? What do you think? Could they already had a fungal